Are you forgetful? Have you had memory lapses? Have you forgotten where you put your keys? Have you forgotten where you parked your car? Have you had trouble finding words? Have you had trouble concentrating and lost your train of thought? Have you forgotten someone's name? Do you refer to these events as a senior moment? Is there such a thing as a senior moment? If there is such a concept, how is it different from dementia? What is Alzheimer's and how does it relate to dementia?
Well, Alzheimer's is a type of dementia. The overall term is dementia, but there are many different types. We define dementia as having a disease in which there's obviously a change in personality and memory, many cognitive domains. There are certain specific criteria for the term Alzheimer's.
And what are those criteria?
We find there's an impairment in memory, decreased capabilities of imprinting and retaining new information, or decreased ability to retrieve previously learned information. We find disturbances in language or aphasic difficulties. It can lead to decreased...
Excuse me, what do you mean by disturbances in language?
People lose the ability to understand other people's spoken language, that's called receptive aphasic difficulties, or to be able to speak expressive aphasic or expressive language difficulties. People with dementias are losing the meaning of certain words. We also find people develop something called agnosia, decreased ability to identify or recognize once familiar objects or people. Many times a person with a dementia will not recognize a loved one. It could be somebody they've been married to for 50 years. It's not that they've suddenly forgotten who the person is. They know who their spouse is. The problem is the person they're looking at doesn't look anything like what their brain tells them that person used to look like. It's because the brain's ability to take in the information through the sensory organs, in this case the eyes, and synthesize that information into meaningful patterns, that is lost. We also find that people develop what are called apraxic difficulties or apraxia, decreased capabilities of carrying out very specific previously learned motor activities, brushing your hair, brushing your teeth. When you lose these abilities, independent living becomes far more difficult. We also find that patients develop difficulties with what we call executive functional capabilities, planning, organizing, and sequencing. When the basically critical mass of all these difficulties increases and it has a major impairment in your ability to function, then we start calling it an illness. And the term we typically give, if there isn't any other obvious cause, such as a stroke or traumatic brain injury or medication side effect or some other illness acutely causing it, we would give it the term dementia, and it might actually turn out to be what we call Alzheimer's.
Now, what should, in your opinion, what should family members be concerned about when they feel that an elder parent or an elder family member or a loved one seems to be slipping in terms of his or her memory?
Some deterioration or decline in cognitive capabilities in memory and thinking does occur with the aging process, but we don't call it an illness unless we think it starts getting to the point where it has disabling effects on the rest of your life.
Let me present some scenarios and see what you think. Let's take somebody who's, as a child, whose primary language was something other than English.
Yes.
Begins speaking in their primary language again, whatever that might be. Is that a sign of dementia or is that a sign of something else?
It may or may not be. If they did not do that while talking to that individual for many years, and now suddenly they're bringing in words from the language that they spoke when they were young, that's highly suggestive that they're losing the ability to speak in their newfound language. They're having difficulties in that language, so they're naturally reverting, when they know the names of things and words for it, to the language they knew when they were young. And the things that we learned earlier in our lives tend to be retained longer.
How about a different scenario? You have a person who has spent 50 years of his or her life dealing with complicated financial documents, hits age 76 and all of a sudden finds it's all very overwhelming, can't do it anymore, needs to pass that on to somebody else. Is that a form of dementia, or is that simply somebody who's gotten older and perhaps lost interest?
Handwriting begins to change. You see it becomes sloppier or much smaller or significantly is altered. Or you see mathematical errors in somebody who never made these errors before, and you can't explain it on the basis of anxiety or on the basis of a vision problem. Then you have to begin to wonder if these difficulties might be suggestive of a more global degenerative process that might lead one to a dementia.
Person who's 76 and depressed, does that person exhibit similar symptoms to somebody who's 76 and has early stage Alzheimer's, let's say?
Many times when people develop a mood disorder when they're older, they also develop what is called a pseudo-dementia. Pseudo-dementia meaning that if you treat the mood disorder and it goes away, many times the cognitive difficulties will go away as well.
Now, another scenario, let's say we have, again, man or a woman and has some serious surgery. Following that surgery, that the person's beginning to exhibit changed behavior.
Yeah.
Is there any connection there?
Many times we see early manifestations suggestive of a dementia, word finding, memory difficulties, behavioral changes, and they may go away after a few weeks and never return. But if significant difficulties behaviorally develop and the patient's not felt to be suffering a pneumonia or urinary tract infection that might be inducing a delirium, if you see these manifestations early on and they persist beyond a few hours but out a few weeks, even if they go away, that patient is at a much higher risk for the development of cognitive difficulties and maybe developing a dementia several years down the road. In fact, there are some statistics on this with people who have coronary artery bypass grafting and have major difficulties cognitively, behaviorally after surgery that improve, they go back to normal. But the data shows permanent cognitive deficits at 6-month and 2-year follow-ups that far exceed the rates that they might have had they not had the surgical procedure.
What about the use of alcohol or cigarette smoking?
Alcohol can clearly compromise cognitive capabilities, especially if a person's intoxicated. Cigarettes typically do not.
What about significant trauma to the head?
Traumatic brain injuries are quite a problem. It turns out that recent studies done by the NFL, the National Football League, have shown that you have orders of magnitude greater risk for the development of a dementia, and not just any dementia, but Alzheimer's, if you have a significant traumatic brain injury, leads to a greater vulnerability of plaque being deposited in the brain, and plaque is one of the pathological hallmarks. Worth noting that these cognitive difficulties develop as we lose the chemical acetylcholine. This chemical is a neurotransmitter throughout our body.
It's true, isn't it, that you never know 100% unless you do an autopsy whether somebody has Alzheimer's.
That's true. You can only diagnose this disorder usually at post-mortem. But if you wait to know with certainty as to whether you should treat, they've died, and generally the treatments aren't very effective after you've died.
No, they aren't. So how do you test somebody for Alzheimer's? Usually
we do some sort of questioning and answering. I think it's very helpful if you examine a patient and know the patient not to have another relative come in and answer the questions. And if they start looking at their healthy spouse for reassurance that they've answered it correctly, that is a very bad sign.
I also want to meet with that person alone. My reason is I want to make sure that they're competent and they know what they're doing.
Combination therapy can cut the rate of decline by about 50% over the long term. No, you will not see people suddenly getting better. The disease will not go away. But if you look at people 4, 5, 6 years later, they will be half as deteriorated as somebody who might not have been treated. That's what the newer data suggests.
Okay. It's clear, though, that no one has come up with a cure for Alzheimer's.
Absolutely not. There is no cure. I know they're beginning in other countries, including Vietnam, to look at stem cell research.
Just like the rest of our bodies, as we age, our brains change. In the past, people believed memory loss was a normal part of aging, often regarding Alzheimer's as a natural age-related decline. However, serious memory loss, confusion, and other major changes are not a normal part of aging. They may be a sign that brain cells are failing. Alzheimer's disease gradually and painfully destroys a person's memory and ability to learn and carry out daily activities such as thinking, talking, eating, ability to connect with others, find his or her way home, and go to the bathroom. As the disease progresses, individuals may also experience changes in personality and behavior. Unfortunately, there is no cure for Alzheimer's disease and therefore no survivors. The good news is that early Alzheimer's diagnosis and treatment can slow the progression of Alzheimer's symptoms.